Hello, everyone. My name is Preeti Prabhughate, and I'm the Director of Grants Management and Impact for the SVRI. I'm delighted to welcome you all to our third webinar in our new virtual series, Voices from the SVRI Forum 2024, Strengthening the Field Through Shared Learning. This series is made possible through co-funding from the Australian Volunteers Program, and we are deeply grateful for your partnership with the SVRI and for your continued commitment to advancing learning and field building. Over the past few months, we've unpacked key findings from the SVRI Forum 2024, most recently exploring technology-facilitated gender-based violence and economic empowerment. If you missed any of those sessions, recordings are available on the forum website. In today's two learning sessions, we will continue our journey by turning our focus to learn more about intimate partner violence. We'll hear how data-driven insights, community-engaged strategies, and survivor-centered perspectives can be brought into a cohesive response so that together we can more effectively interrupt cycles of violence in the home. Next slide, please. Just a few quick housekeeping notes before we begin. Today's session will run for 1 hour. All the sessions are being recorded and will be publicly shared on SVRI's and AVP's platforms. The audience is muted, but we would love for you to introduce yourself in the chat. Please let us know your name and where you're joining from. We welcome your question and answers and reflections throughout. Please feel free to use either the Q&A box or the chat, and we'll do our best to bring you as many questions as we can in the conversations as time allows. Could we move on to the next slide? A quick look at our agenda today. We'll begin with an overview of key IPV-related findings from SVRI Forum 2024. This will be followed by a moderated panel discussion with our invited speakers today. We'll then move into a live Q&A with your questions. And finally, we'll close with next steps and share upcoming webinar in July. Next slide, please. I'm very delighted to introduce you with our esteemed speakers for today. Please join me in welcoming Liz Dartnall. Liz Dartnall is a public health specialist, and she is also the executive director of SVRI with over 20 years experience globally in advancing research and policy on violence against women and violence against children. We are also joined today by Hadija Ashkar. Hadija is a researcher and practitioner with extensive experience in designing, implementing, and evaluating interventions to prevent violence against women and violence against children and suggest diverse communities across humanitarian and development settings. We are also joined today by Loral Baradza. Loral is a gender and social norm specialist at Procare, leading evidence-based community-driven approaches to preventing gender-based violence and promoting women's leadership. Warm welcome to you, Loral. And we're very grateful to Joanne, who has kindly replaced Alexandra, who couldn't be on the webinar today. Joanne Njagi is a researcher at SVRI with over 15 years of experience in sexual and reproductive health rights and child protection with a focus on violence prevention, sexuality education, and digital rights. Thank you everybody for joining us today. I'd now like to invite Liz Dartnall to share a high-level overview of forum findings related to IPV. Over to you, Liz.
Thank you so much, Preeti, and thank you for the kind welcome. And I'd also like to thank my esteemed panelists for today to being with us on this really important panel. And thank you to the Australian Volunteers program colleagues for partnering with us on this really important and insightful series. And thank you to all of us in the room for joining us for this discussion on intimate partner violence. Next slide, please, Liesl. As you know, the SVRI Forum brought together over 1,500 researchers and practitioners from over 112 countries. And I'm going to talk about what the research has been revealing about what we need to think about in terms of our approaches to IPV prevention and response from the forum findings. Next slide, please. So I'm going to focus on 5 key learnings from the forum that I think really are important and need to be on our radar as we work hard to continue to respond and prevent intimate partner violence, particularly in these difficult and complex times that we find ourselves in. First, tech-facilitated intimate partner violence, a completely new form of violence that did not exist a decade ago, requiring urgent response. Second, I want to talk about the climate violence nexus, emerging evidence that environmental stresses are creating increased IPV vulnerabilities. And third, why longitudinal research is important, from understanding the drivers of violence to measuring real program impact. Fourth, why our current funding and scaling systems aren't helping our interventions to be effective. And 5, why we need to work in more integrated ways. So not mind-blowing insights, but really important things to be thinking about as we continue in the journey of intimate partner violence prevention and response programming. Next slide, please, Liesl. So let's first start with tech-facilitated intimate partner violence. As we discussed in webinar 1 of our series, and I do encourage you all to go and look at that recording because it was a great series webinar. We are seeing entirely new categories of violence: sextortion, where perpetrators blackmail victims using sexual content, image-based abuse, sharing intimate content without consent, and increasingly AI-enabled harassment using deepfakes and voice cloning. We are seeing perpetrators using location tracking to re-victimize survivors who have tried to escape this form of violence. But what we also know and are finding that technology is not just creating problems, it's creating solutions. For example, we shared in the first webinar Brazil's Ayana chatbox, the intervention. This AI-driven tool provides legal and psychological support through intelligent search, which means that it's understanding what survivors are asking for and connecting them to the right services, tracking conversation history, to provide personalized responses. And what's really important about this, it was developed in partnership with survivors, which is what we are talking about when we talk about survivor-centered design. So the key insight is technology is evolving faster than our policy and programmatic responses can keep up with. And so we have to respond proactively rather than just reacting to harmful uses. And this requires urgent investment in survivor-centered digital solutions and legal frameworks that can keep pace with technological change, whilst at the same time we continue to build the evidence. Next slide, please, Liesl. The second insight I want to share is evidence on the climate violence nexus. At the forum, colleagues presented super important research showing that severe droughts in countries like Lesotho, Zimbabwe, Namibia, Mozambique are directly linked to increased violence against girls. In Lesotho specifically, teenage girls face an 11% additional risk of being HIV positive following drought crises. And they talked about the mechanisms, which are clear. When crops fail due to drought, families face economic stress that can trigger violence. When communities are displaced, protection systems break down. When food becomes scarce, survival strategies often put women and girls at increased risk. This isn't a future threat, it's happening now. Climate emergencies are becoming more frequent and severe, and our traditional IPV prevention models simply don't account for environmental stresses as risk factors. So the insight, environmental stresses compound IPV risks, and prevention must adapt to climate realities. We need climate-responsive prevention strategies and humanitarian preparedness within GBV expertise embedded from day one. So next slide, please. The third insight is why longitudinal research is essential, from understanding the drivers of violence to measuring real program impact. The Birth to 20+ study presented at the forum from South Africa followed participants from childhood to adulthood, showing how early violence exposure shapes later IPV experiences. Longitudinal research is equally important for understanding whether our interventions actually work in the long term. And some apparent short-term successes actually aren't holding up over time. For example, finding from a study on corporal punishment called GAGE, whilst not an IPV, shows us why longitudinal studies are important. The initial studies on this intervention were really looking promising, with corporal punishment declining across 20,000 adolescents across 6 countries. But when the adolescents were tracked over years, it was found that this wasn't due to changing social norms, which we thought it had been. We found that participants were simply aging out of the program without long-term tracking, we mistake developmental changes for program success. But the good news is that contrasts sharply with the Bandebarejo program's 6-year follow-up study, which showed sustained 55% reductions in physical IPV and 50% reductions in sexual IPV, demonstrating lasting change in not just violence, but also relationships, parenting, and mental health. So the insight here is that many effective interventions that show promise in the short term may not be effective in the long term. And we are making scaling decisions based on 12 to 18-month studies for interventions that sometimes needs years to show true impact. Investment in longitudinal research isn't just a nice to have. It's really important for understanding what is actually working. Next slide, please. One of the fourth insight that we found in the forum programs shows real fundamental contradictions in our field. We know from evidence that social norms change, as I've just previously talked about, does take years of sustained effort. Yet findings presented at the forum shows that 72% of organizations working on violence against women and girls in Africa receive grants of 1 year or less. I think this shows a fundamental mismatch between what evidence tells us is working and how we resource that work as a field. Presentations, discussions raised up 3 interconnected crises. First, a scaling crisis where programs are expanded too quickly and based on a real need to respond to this issue, but based on only single studies, losing core principles in adaptation. Second, a funding crisis where many organizations are receiving only project-based funding, unable to build relationships or institutional capacity, really needing to shift social norms in communities that they're working. Third, a time crisis where pressure for fast impact contradicts community-led models that we know are having effective reductions in IPV in the communities that they're working. So take economic interventions as an example for the importance of sustained programming. We know that giving cash coupled with important change training, coupled with behavior change training does work. The 9-year Bangladesh study found that lasting IPV reduction, however, depends on whether or not women maintain economic security after these programs end. We know that if economic stability disappears when the program stops, that IPV rates can return to previous levels. And this is another reminder of why we need longitudinal studies. So the insight, our current systems are structurally not serving effective IPV prevention. We need fundamental changes in how we fund to sustain and scale interventions, not just better programs. And now I want to highlight one more insight, the power of integration. And this insight, I think, cuts across all of these issues. In day 2 plenary of the forum, Prof. Mary Ellsberg reminded us that where children experience violence, women often do too, and vice versa. Integrated approaches and addressing both forms of violence together show significant promise and improves scalability compared to standalone programs. For example, the Indus Shakira program implemented in Syria achieved almost 50% IPV reduction by engaging women, children, and communities together, not separately. This approach demonstrates the potential for more efficient resource use and creates opportunities to address shared risk factors rather than just treating symptoms in isolation. So the insight is that we cannot address IPV in isolation, and when we do integrated approaches, they can be more effective. Next slide, please. So I think these insights ask for some 5 kind of key actions. First, innovation around technology. We need investment in survivor-centered AI and digital solutions, plus legal frameworks that keep pace with technological change. Second, climate adaptation. IPV programs in climate vulnerable regions must build in environmental considerations into the design from the beginning. Third, in an evidence revolution, we need to fund longitudinal studies over the short-term over short-term evaluations. We need both, but we need to have long-term studies as well. And we need to involve survivors as genuine decision makers. And we also need more studies that look at different multiple forms of outcome measures. And fourth, we need systems change. This means long-term core funding for organizations. We need to invest in scaling science before we scale programs, and we need to align funding cycles with actual timelines of social change rather than annual reporting cycles. And finally, integration. We have to break down silos from across all forms of violence prevention, not just between IPV and child violence, but across sectors, issues, and the full spectrum of violence. This means more unified program that addresses the interconnected nature of violence, coordinated funding that doesn't force us to make some artificial choices, and shared measurement systems that work to capture holistic outcomes. So in closing, I just want to remind us that we have an evidence base that is stronger than ever before, a global community committed to change. We have innovation happening across multiple fronts, from AI-driven survivor support to climate-responsive prevention strategies. So the question isn't whether we can end IPV, it's how we're going to apply learnings from the forum with the urgency, resources, and collaboration they demand. And now I'm going to hand over to Liesl to talk about SVRI Forum 2026, which is an important place to really be discussing this question and more. Thank you, and over to you, Liesl.
Thank you so much, Liz, and thank you for grounding us in the powerful findings of the SVRI Forum 2024. So before we move to the presentations from our panelists, I'm just very delighted to share some exciting news. So the SVRI Forum 2026 is coming, and we'll be gathering at the Sentara Grand Hotel and Bangkok Convention Center at Central World in Thailand from the 5th until the 9th of October 2026. This will be a truly global moment for researchers, practitioners, activists, and policymakers to come together to connect, share, and learn. Abstract submissions and registration will open in August 2025, so please do stay tuned via our website, our social media, for more details. So we can't wait to welcome you there. Preeti, over to you and the panel.
Thank you, Liesl. We shall now begin with the presentation from the panelists. May I invite Hadisha to begin with the presentation?
Thank you so much, and glad to be here. So what I'll be talking about today is the typologies of overlapping intimate partner violence and violence against children in the home. And so I'm going to use a method called latent class analysis, which I will explain. And so we'll just say, if you have any questions, it can be a little bit confusing, but please do feel free to ask them. And we're looking at 3 different contexts on the African continent: DRC, Ethiopia, and South Africa. And so next slide. And so just wanted to note that over a 1-year period, 1 in 10 women experience physical or sexual intimate partner violence, and 1 in 2 children experience physical, sexual, or emotional violence. So when we're talking about these 2 issues, we're talking about violence that exists at epidemic proportions, even without an emergency. And so addressing these things individually is really important, and I think everyone on this call agrees on the importance of addressing intimate partner violence and violence against children. But what we wanted to understand was, how do these forms of violence overlap? And so we had 2 key questions. So one was, what are the distinct typologies and overlap of intimate partner violence and caregiver-perpetrated violence against children in the home in DRC, Ethiopia, and South Africa? And then the second question, which will give you very quick a quick summary of the findings, is does the impact of an intimate partner violence and violence against children prevention intervention differ among families which are characterized by distinct family violence typologies at intervention outset? So in other words, what that means is, at the start of the intervention, if there were families with different configurations of violence present, do we see the same findings or impact of the intervention, or do we see a difference in the impact of the intervention based on that violence. So go to the next slide, please. And so why are we looking at this? And so although there's been a lot of growing research over decades around intimate partner violence and on violence against children, especially in context in the Global South, there isn't a lot of information around co-occurrence. So what we know is that there's about 10 to 30% prevalence of co-occurrence in high-income countries, and we don't quite know systematically what that prevalence is, but what we've seen from some existing studies is that it can be as high as 50% in contexts like the DRC. And so we have conceptual recognition and measurement of overlapping forms. And so this is a gap, sorry. So just the slide is covering what some of the gaps are and then how we sought to address them. And so in addition to not having an overall prevalence of the co-occurrence, there are also some gaps across conceptualization, across measurement, and then also in terms of how we do the research, who we interview. And so although there's been greater conceptual recognition of the overlap, what we found is that there are some forms of violence which are not necessarily consistently measured, but then may have some level of overlap. So for example, economic intimate partner violence is not always measured and is only recently actually been researched in more depth in context in the Global South. And then deprivational neglect amongst children, which we know can be a contentious question is whether it's intentional or unintentional neglect, right? So what is the overlap between neglect and poverty? And so how are we addressing neglect which is intentional? But what we sought to do in this research was that for the studies that included measures of deprivational neglect and economic IPV was that we included them. A second gap is that there hasn't historically been inclusion of adolescents in research and decision-making on strategies to prevent and respond to violence against children. And so where possible, we also used adolescent self-report. So asking them about their own experiences of violence, the same way we would say that we should ask women about their own experiences of violence. And the last piece was that we often rely on binary composite measures to separately assess prevalence predictors and consequences. So often we see lifetime IPV exposure, for example, and we might see retrospective also lifetime violence against children exposure. So in order to look at these typologies, what we wanted to do was actually look at the differences by form and frequency of violence. So looking at physical, emotional, sexual violence, for example, separately and seeing actually what forms of violence might we see and do we see them at different points of intensity. And so the underlying rationale for this is that a one woman, one child approach ignores the reality that violence doesn't occur in a vacuum and that when people are living in an environment that's characterized by fear of violence, that actually that can affect the well-being of everyone. Next slide. And so I'll go through these really quickly. So we have 3 different studies. So in DRC, we used data from the Safe at Home study. This was 394 male-female couples that had a child aged 6 to 12. In Ethiopia, we used data from the GAGE study, or the Gender and Adolescence Global Evidence Study, looking at the years 2018 to 2019 with 4,195 female caregiver and child dyads. In South Africa, we used the Interrupt Violence Study. So that's looking at the years 2022 to 2024, specifically looking at 224 female caregiver child dyads. Next slide. And so we used slightly different analyses for a couple of these, and I'll talk through them quickly so we can get to the findings. But what we did was we used a method called latent class analysis. What latent class analysis does is that it allows you to group people by shared characteristics. And so in this case, we wanted to see if there are different groups of families by the forms of violence that are present. And for the differential intervention impact, what we did was we used intent to treat ordinary least squares regression. And so within East baseline violence typology, we compared intervention and control participants to look at IPV and violence against children summary scores. And we adjusted for baseline household size, caregiver education, and child gender. The graphic that you see here is on Ethiopia. So just showing that for Ethiopia, we needed a special method for latent class analysis. So we looked at intimate partner violence and violence against children separately, and then looked at predictors between intimate partner violence and violence against children. But in the other countries, we looked at all of the items for intimate partner violence and violence against children altogether. Next slide. And so just starting with South Africa, what we found first was that there were about 40% of families in which there was no intimate partner violence and also very low physical violence. So what we see on just how to show you how to read these is on the bottom, we have the different forms of violence. So intimate partner violence is on the left side, and then violence against children measures are on the right side. And then the percentage is 0 to 100% is the probability that we would see that form of violence within the class. So looking at the second group, or the green group, that was 46%, which had no intimate partner violence alongside physical and emotional violence against children. And so just noting here that there was 100% probability of violence against children. So it was quite high probability of experiencing violence against children, but not intimate partner violence. Our last group, our third group was had 4.5% of the participants, and this group was characterized primarily by presence of emotional intimate partner violence, specifically insults and humiliation, alongside physical and emotional violence against children. And just noting that deprivational neglect was highest in this group. Next slide. And so with the last group, we had about we go back one. We had about 8% that reported systematic intimate partner violence and violence against children. So this was high probability of seeing multiple domains of intimate partner violence. So emotional violence, such as insults, physical violence, such as slapping, hitting, and severe forms of physical violence, such as like choking, burning, use of a weapon. And then alongside also high probability of experiencing physical and emotional violence against children. So that's just to say in summary that there was essentially 8% of families, we saw some pretty severe forms of co-occurring violence. And then in an additional 4% of families, we saw high probability of specifically emotional intimate partner violence alongside violence against children. And then in the rest of the families, we saw mostly violence against children or no violence. All right, next slide. And so we'll just go through this part quickly. So for Ethiopia, we found 6 classes overall. And so just noting that 3/5 of women were most likely to belong to the no or low IPV class. We had 3 classes that were characterized primarily by emotional and or economic intimate partner violence. And we saw in those classes specifically low probabilities of physical or sexual intimate partner violence. And so also just wanted to note that we saw different classes by types of economic abuse. So there was one class characterized by economic IPV related to women's earnings. And then there was another class that was characterized primarily by economic IPV that was related to men's earnings. So just to note that there was different groups of families there. Next slide. And so we also saw then 2 of the classes we saw. We had one class as well that was characterized by systematic IPV, so high levels of physical, emotional, and economic IPV, but not necessarily as high levels of sexual IPV, and this compared to DRC, which we'll see next. And I realize I don't have much time left, so we'll just keep going. And so violence against children, and just noting that we had 3 classes, and we had one class that was characterized by high prevalence severity of violence against children. And what we saw was that overall, there was 20% of families that were characterized primarily by emotional IPV alongside moderate or high intensity IPV. And in this group in Ethiopia, we saw about 1 to 2% where we were seeing really severe forms of violence that were co-occurring. Next slide. And so just going through DRC, and do you want to just skip to the next one? Yeah, and so just noting here that for women, we saw 4 classes, and we also saw the same pattern of emotional IPV co-occurring with either low intensity or high intensity violence against children perpetration. What we saw here, this was specifically women's reports of their IPV experience and their use of violence against children, was a dose-response relationship. So if there was higher probability of experiencing emotional IPV or high-frequency emotional IPV, then we saw also higher probability of perpetrating violence against children. Next slide. And then here we saw a much higher group. So we saw 17% that experienced high intensity IPV and violence against children. So just noting in comparison to South Africa, where it was 8%, in comparison to Ethiopia, where it was about 1 to 2%. And this was specifically characterized as well by high prevalence of sexual IPV alongside severe physical IPV and frequent perpetration of violence against children. And just noting that, the difference between these contexts is DRC is an active conflict context with compounding emergencies. So just echoing what Liz was saying about climate emergencies, there were also climate emergencies happening during the period of this data collection. Right, next slide. And then we also looked at men. And so the difference that we saw between women and men was that for women, there was a group that had high frequency perpetration of violence against children, but we didn't necessarily see that for men. So just go one more slide. So our group that was characterized by high probability of violence, we had about 53% of men reporting high probability of sexual and physical IPV. So this was, when I'm saying reporting, this is proxy report via their female partners report of their experience. And so, but the men themselves did not report high psychological aggression or physical violence against children. Next slide. And so when we looked at this differential impact, so Safe at Home, just very briefly, it's a discussion-based family violence prevention program. And so it had discussion groups for men, for women, and also a few family-focused discussion sessions. And the idea was that if we were changing knowledge and attitudes and behaviors, that we would see both improved family functioning and prevention of both intimate partner violence and child abuse. What we saw, next slide, was that when we looked at the impact, so overall we saw significant impacts of the intervention. We saw huge reductions in intimate partner violence reporting from women in the intervention and compared to the control group. And we saw moderate reports of reductions of violence against children in the intervention group as compared to the control group. When we broke that down, though, by the types of violence that were present at baseline, so just looking here at the groups for women, so we had 4 groups for women, and what we saw was that the intervention's impact tended to be higher amongst the groups that were reporting lower levels of intimate partner violence and violence against children at baseline. So essentially for the group in which there was high intensity intimate partner violence and violence against children, we saw a marginal reduction only in emotional IPV, but not the other forms of IPV, and we didn't see any reductions in violence against children. So what that means when we put all this all together is, next slide, is just across contexts, we saw family violence groups that were characterized primarily by emotional economic IPV and without the presence of physical or sexual IPV. So what that really means is we need to include emotional economic IPV in measurement. The most commonly occurring pattern of that overlap was emotional IPV alongside moderate or high intensity violence against children. So really we do need to address emotional IPV in our interventions. And the last one was that the discussion-based intervention was more effective in preventing violence rather than reducing violence. And so what that really means is we do need, alongside our primary prevention, greater investment in tertiary prevention for families that might be having greater severity of intimate partner violence and violence against children. Apologies for going over time. That is it for us. And the next slide is just a thank you. So just acknowledging that we've had, multiple projects, multiple funders, a lot of effort across teams, and quite a lot of work done in contexts in which there's a lot of different barriers to research. So also just recognizing, how much work this kind of research takes. And I'm just one person representing on behalf of 3 teams. So thank you all so much.
Thank you so much, Khadija. That was a very interesting presentation. May I please invite Laurel to begin with your presentation? Please feel free to keep sending us your question answers.
Thank you very much, Preeti. My name is Laurel, as introduced, and I'm going to talk about the impact of SASA Faith in integrating faith-based norms transformation to prevent gender-based violence. Next slide, please. So SASA Faith is a social norms change methodology which brings together leaders of a faith community and their faith members to prevent violence against women. It was co-created by Trokra and Raising Voices in 2016, and the rollout of this program began in 2017. It was designed for implementation in Muslim and Christian faith communities. The overall aim of SASA Faith is to change knowledge, attitude, skills, and behaviors in order to prevent violence against women and also IPV, using the values of justice, peace, and dignity. Next slide, please. SASA Faith is a phased approach, and I'm really happy that Liz touched a bit around how the length of social norms methodology. So this methodology requires a minimum of 3 years, which are divided into 4 phases. So the first phase is around the start phase, where we focus on the institution rolling out the program, the community members who will also roll out the program, who we call the community facilitators, as well as the religious leaders. So it's like an incubation period where we start with ourselves, changing our own attitudes and beliefs, and then we move on to the awareness phase, which is now bringing the whole community into the whole context of gender-based violence, violence against women, IPV, and all the different forms of violence within that faith space. The third phase is the support phase, where the community now strengthens their support mechanisms to provide survivor-centered support for people who come out and seek support for violence that they would have faced. And the fourth phase is around strengthening community activism and mechanisms. So between these phases, we conduct a rapid assessment survey where we determine whether the community is ready to move to the next phase. So the results determine whether a community moves or not. Next slide, please. So after in 2017, when the SASA Faith was rolled out, it was rolled out for 6 years in the 6 countries that you see on the screen. And after that, we decided to conduct a study to determine the efficacy of the methodology. And we also wanted to capture the impact and the adaptations that have been done, and also whether to measure whether it was sustainable, although it was really at the right after the program had ended. So the study was conducted across 12 organizations. It was a qualitative design where data was collected through individual questionnaires, key informant interviews, and FGDs. And this was ethically cleared by the University of Stellenbosch. Next slide, please. So our findings revealed that there was reduced gender-based violence through targeted engagement. So SASA Faith looks at the various groups within the faith space, the women, the girls, the youth, the children, the men. So they are all targeted in different spaces where we have discussions. So we found that there was reduced tolerance of GBV as well. There was an increased proportion of people who believe it's wrong to commit violence. So from 70% at baseline to 95% at endline. We also saw the transformation of religious leaders, where 83% of the faith communities reported that the religious leaders are now providing them with survivor-centered response. There were also healthier relationships between couples, signaling reduced intimate partner violence. We also saw that there were strengthened referral systems and support networks, as well as high adaptability and strong sustainability. Next slide, please. So in terms of the religious leaders,
Did we lose Laurel? Yeah. Laurel?
um,
Okay,
sorry,
you're
I
back.
just
Okay. No
yes.
problem. Yeah.
Of the religious leaders, we saw that the religious leaders became more vocal on GBV, and they started to reframe harmful theological interpretations. I think we may understand that religion has been blamed as one of the key drivers of gender-based violence, mainly due to the misinterpretation of theological texts. So what we found is that religious leaders opened up spaces for people to talk about intimate partner of violence, about violence against women and children within the faith spaces. And they also sat down and looked at from a feminist lens. And we also heard participants saying pastors are not just asking us to pray about things, but they're also pointing us to the necessary referral pathway where we can get the necessary support. So for us, it was a really big plus because often religious leaders have also been known to perpetuate violence through the way they provide their counseling. And then we also saw that community activists had increased skill and confidence to deliver SASA faith sessions and psychosocial first aid to the communities. Next slide, please. What in during the period of implementation, we saw that you can move to the next slide, Lizzo. We also saw that the communities have really been, sorry, the slide before had really been transformed. There was a lot of yes, so there was no shift in the communities, and during this period, we launched what we call the Speak Out campaign, which was based on a biblical verse, encouraging people to speak out against violence that they face. So there was a really emerging activism and informal support networks that increased the voice and agency of women and girls to speak out against gender-based violence. And we saw couples coming through. Both men and women reporting healthier, equitable relationships, balancing their power, communicating effectively, and joint budget and decision making. I think the previous presenters have spoken about emotional and economic violence as things that have not really been explored. So we saw that in this methodology, through the discussions that they had, there were elements of joint budgeting and joint decision making. Next slide, please. So SASA Faith was also rolled out during the COVID era, where we could not really meet with the communities day to day, and adaptations had to be made. So some sessions moved from physical face spaces into digital spaces like WhatsApp groups.
I think we lost her again. Yeah, I think she'll be back. Yeah.
So we also found that the communities were able to engage, and this was a really positive aspect during the COVID-19, where people could get information on violence that they would have faced and they could get support. And we saw that project participants said the methodology was really effective because they felt the connection to SASA faith and religion made them instilled a lot of changes in their faith spaces. They also managed to make faith gender desks and in their faith spaces, so that even after the program, there's still support systems where they can find the information and support that they need. Next slide, please. So some of the factors that we saw, we have already taken these into our current practice. So we now have a community of practice established in Zimbabwe and Malawi. And currently Malawi chairs the SASA Faith Community of Practice, which brings practitioners who are preventing violence through SASA and SASA Faith methodologies. And before the USAID top order, we had also seen the scale up of SASA Faith in Malawi to 9 more districts. Unfortunately, we lost that part of that funding due to the USAID. And then we've also devised some, we've also designed guidelines for the remote modalities, where we actually provide remote support to our communities who are implementing SASA faith. Religious leaders have been strengthened through survivor-centered response mechanisms. And we've already started to engage men, which was one of the key findings of the research, that very little men were coming through to the faith spaces and were being engaged. So we've gone onto a learning exercise where we've started to really engage men so that they also become part of the sessions. And then finally, can move to the next slide. We realized that why SASA Faith works, because SASA Faith is a powerful lever for social norms change. Is framing resonates with many communities, especially in the development context, where over 80% of the population are religious. They belong to a certain religion. It focuses on power, not just violence. So it goes to address the root cause of the violence that is within the communities. It's approved, rooted, and ready for replication methodology. And we also have seen that it's really scalable through the example that I've spoken about in Malawi, and it provides faith-based solutions that come from the faith communities themselves, because at the end of the project, they were at a point where they were now coming up with their own solutions and local bylaws able to prevent violence in their own faith spaces. And because community ownership, it's not a confrontational methodology, so it brings everybody together through a period of reflection, and that in itself brings lasting change. So thank you for your time.
And thank you so much, Laurel, for that very insightful presentation. May I invite Joanne to begin your presentation now?
Thank you, Preeti. I'm very pleased to present on the global research priorities on intersections between violence against children and violence against women. Next slide, please. So our approach to this process acknowledges that historically, research priorities have often been set by small groups of academics and experts, with powerful members of priority setting groups having undue influence on final decisions on what questions get included. So in response to this, the CHINDRI, which is a Child Health and Nutrition Research Initiative, was created. And the CHINDRI model is based on the philosophy of crowdsourcing, which proposes that asking multiple people for their opinion on an issue will result in accurate predictions, surpassing the expert judgment of one individual. To develop this global set of priorities for research on the intersections between violence against women and violence against children, SVRI, UNICEF, Innocenti, and WHO adapted the CHINDRI process, building on several previous exercises that SVRI has been involved in, including more recently the Global Research Agenda on Child Sexual Violence in Low and Middle Income Countries. Next slide, please. The first adaptation of CHINDRI was the creation of a broader set of advisory structures, and these were bigger and more expansive than what is done in a traditional CHINDRI process. So to steer and validate the process, and these were to steer and validate the process, and they were also instrumental in ensuring that the process was inclusive and diverse. So we had a coordinating group, which included representatives from SVRI, UNICEF, Innocenti, WHO, and a technical expert on the CHINDRI methodology from Stellenbosch University. Then we had an advisory group comprised of 12 experts selected on the basis of their expertise and representing practitioners and researchers from different parts of the world. The advisory group was invited to draft and submit questions as part of the question collection process and to provide feedback on the consolidation of questions. The group continued to monitor the whole process as well. Then finally, we had a global stakeholder group, which represented a wider range of stakeholders working violence against children and violence against women across the globe. We had around 510 people registered to participate in the process as part of the global stakeholder group. And colleagues from this group participated in 4 webinars to learn about the research priority setting process, and they also helped to disseminate the 2 surveys amongst their networks. Next slide, please. Our further adaptation of CHINDRI for the co-creation of this set of global priorities involves 7 highly participatory steps that engaged hundreds of stakeholders throughout the process. The steps included the commissioning of 2 systematic reviews on the intersections of VAC and VOW, through which we developed domains that framed the entire process. The identification of domains was followed by the generation of research questions. So everyone involved in this process, that's the global stakeholder group, the advisory group, and the coordinating group, was invited to submit key questions they would like answered about VAC-VAU intersections for each of the 5 domains identified. And this was done through an online submission form, which was available in Arabic, English, French, Portuguese, and Spanish. Through this process, we generated a total of 463 questions from 86 respondents. And the coordinating and advisory groups organized submissions by removing duplicates and reducing the number of questions to be scored to 45, which brought them to around 8 to 10 questions per domain. In the third step, the coordinating group together identified and defined the criteria to be used in a scoring process. So each research question was scored scored on each criterion, and the 3 criterion were applicability and impact, advancing the evidence base, and answerability and feasibility. In the fourth step, the 45 research questions were built into a survey with scoring options according to the 3 criteria. We had diverse stakeholders working worldwide to address VAC and VAU who invited to score the research questions. And again, the surveys were available in multiple language, Arabic, English, French, and Spanish. And we had 153 surveys completed and included in the analysis. In the fifth step, data from the 153 surveys were then analyzed and the research questions were ranked according to a research priority setting score. So it was a score from 0 to 100, ranking the extent to which respondents believe that the research question best satisfies the priority setting criteria, back to applicability and impact, advancing the evidence base, answerability, and feasibility. We then held a validation workshop with stakeholders at the SVRI forum to critically examine the results and finalize the priorities. Next slide, please. So the 2 systematic reviews that I talked about earlier, supported by UNICEF Innocenti, helped us with the domains that guided and framed the entire process. So the 5 domains, we had domain 1, strengthening our understanding of VAC-VAU intersections. Domain 2, interventions and services focused on VAC-VAU intersections. Domain 3, tools, methods, and measurements in VAC-VAU intersections research. Domain 4, coordination and collaboration across VAU and VAC sectors. And domain 5, policy research. Next slide, please. So to ensure that we reached underserved and under-researched groups, that is groups of people whose voice are often excluded from these processes, we use several strategies. First, we had the advisory groups and expert groups reach out to their networks and act as ambassadors for the project. Then we also continuously monitored the responses and actively responded to the gaps. We also had regular touch points with advisory structures in the field through webinars and communication efforts. And we also ensured that the survey tools were user-friendly and available in multiple languages. And as far as possible, interactions with partners was done in the multiple languages that we had available: Arabic, English, French, Portuguese, and Spanish. Next slide, please. So I'll go into the findings. So we had a total of 153 respondents, as I mentioned earlier, from 50 countries who completed the survey, and 82% of them were female and 59% worked in low and middle income countries. 44% identified as practitioners, 41% as researchers, and we had a bit of underrepresentations from donors and policymakers. The majority of the respondents said they worked on both forms of violence, VAC and VAU. And we took several steps to ensure to reach historically marginalized groups. And this is reflected in the fact that 9% of participants identified as LGBTQI+, 14% as minoritized racial or ethnic groups, 10% as indigenous people, and 9% as individuals with disabilities. Next slide, please. So I'll be presenting on the research priorities, and I'll begin with the first 5, just looking at what research questions did the diverse group of colleagues identify as priorities. So I'll start off by saying that there was a wide level of agreement amongst respondents, and this is evident in the similarity of the scores, which ranged from 80.6 to 94.9 across all 45 questions identified. Often with such processes, we see a much wider variation in scores. but the similarity in scores for this agenda suggests harmony in the field. So on the screen, you see the top 5 questions, and interestingly, our ranking leans towards intervention research, which is domain 2, rather than epidemiological research, which is domain 1. In other words, participants felt that perhaps we have sufficient knowledge about how these forms of violence intersect, and that we must now prioritize evidence that will help us design better programs and policies to respond to these intersections. The top question then pertains to what are the key elements of effective integrated programs to address both violence against women and children. And the second one looks at how parenting and caregiver support interventions can be adapted to prevent multiple forms of violence against children. And the third priority pertains to innovative ways to measure violence against women and children, which have been developed and tested in low settings through participatory approaches. And the fourth one speaks to the development of common language and shared framework for effective coordination and collaboration, while the fifth one focuses on policies that can address both forms of violence in coordination. So the next slide, we look at priorities 6 to 10. And the sixth one also addresses the issue of coordination. The seventh one asks how effective prevention interventions actually achieve change. And then interestingly, questions 8 and 9 focus on adolescents, which we know from the evidence is an age group that is often overlooked by both the violence against children and violence against women fields. And question 10 falls under domain 3 on tools and methods, and asks how we can evaluate interventions for the primary prevention of VAC and VAU. Next slide, please. So I already talked about the different characteristics of respondents, in the similarity across respondents. So I'll skip this because of time, and we can move to the next slide. So in terms of lessons and limitations, we are very proud of how participatory and collaborative this process was, and about the diversity of the respondents. But with any methodology, there's always room for improvement. And we know that 153 respondents is quite a large group for such an exercise. And it's not uncommon to have similar prioritization exercises with 50 individuals or less. However, a much larger group had initially registered to participate. And again, this group was diverse across many categories, but there were some gaps, including in specific geographic areas and categories of professionals. So 82% of respondents were female, and while this is an accurate reflection of the field, it remains to be seen if the results would have been different if more male and non-binary respondents participated. And finally, the results of this process reflect the priorities identified by those who took part in this process, due to the multiple efforts that we made to reach diverse constituencies. However, some important research areas were not selected, including adverse childhood experiences, school-based violence prevention, and laws, for example, to include access to divorce, to reduce alcohol use, and to ban corporal punishment. Then the next slide, please. So it's important to note that all the 3 organizations involved have already begun applying these insights to shape our work, and I will not go into details because of time. But I just want to highlight a key example from SVRI. Next slide, please. Should be the next one, which has used the findings to inform the selection of research projects for funding and to shape the themes of the SVRI forum. So thank you so much for your time, and thank you to everyone who participated in the creation of these research agendas. Thank you so much. And over to Preeti.
Thank you so much, Joanne. And we unfortunately have no time left for a question and answer session. I now invite Liz for the closing.
Thank you so much, Preeti, and thank you everybody for joining us today. Look what happens when we get a bunch of researchers and practitioners on a call. We just have too much to say and we run out of time. But I really want to thank everybody for this really enriching conversation on intimate partner violence. Presentations and discussions at the forum really show us that the question is no longer that whether we can end IPV, we can, but how can we build on what we've learned both today and from the forum? I want to really give a big heartfelt thanks to our partners at the Australian Volunteers Program for co-funding this series with us, but also deeply grateful to our speakers, Kajeja, Mubaratza, and Joanne, for your important work and for so generously sharing your time and insights with us. Thank you, Preeti, for guiding us through the session today with such clarity and kindness and keeping us to time, almost. And to Liesl and Tenyika for producing today's event. Without you, this would not have happened so smoothly. So to stay connected and keep building the field together, please do sign up for the SVRI newsletter. Don't forget, SVRI Forum is going to take place in Bangkok. Please join us. It's from the 5th to the 9th of October, 2026. And we will be sharing abstract submissions and registrations in August. And just to let you know that the workshop conference registrations is already out. So do look out for that if you're considering hosting a pre-conference workshop at the forum. And a final word from all of us. Ending IPV does require sustained effort, doing a lot, doing it often, and doing it over time. And above all, it requires working in a more integrated and collaborative way, in the same way we have all come together for this panel. So thank you, everybody, for joining us. See you all soon for the next one. Thank you.